getting trauma victims to an appropriate level of care within that golden hour, if you can see the difference that it makes in their prognosis, in their recovery times, in how they can return to the life that they were living before, you realize the importance.
You know, we've transported some 34,000 people since I've been here. Today we cover 34 counties in Northern California and Nevada. We average some 3,500 transports a year, and as many as 100 hospitals will be receiving the patients that we're delivering. That's had an effect on a lot of lives.
CALSTAR's goals from the beginning have been to deliver high quality medical care, to do it with excellent flight safety, and to do it in a way that's community-based and that prevents a non-productive, competitive arms race between hospitals trying to outdo one another. We've achieved it, and I think the challenge is to preserve what we've achieved.
How CALSTAR started really goes back into the 1970s, when there was a lot of talk in California about starting trauma systems. As they discussed that, the concept of having transportation and the need for rapid transportation became a focus of their discussion, and with one helicopter, they started training nurses in the summer of 1984, and the first patients were transported in September of 1984.
The vision of CALSTAR being a consortium, a community-based nonprofit organization that wasn't run for the benefit of any particular hospital was very important.
We are constantly striving to improve ourselves, to improve our knowledge base, constantly training.
If you don't keep up with the times, eventually you get further and further behind. We find that in the medical environment with the equipment and the procedural things that nurses have to do, but also in the aircraft, maintaining them and modernizing them and keeping up with the technology that's available that allows us to do our job better, safer, more efficiently.
As you look at the technology changes that are happening, whether it's in medical care or in aviation, you know, marrying these two fields is a tremendous challenge.
We've evolved with very good equipment, but there's a lot of emerging technologies that we could capitalize on.
While the technology continues to improve, the cost of the technology doesn't seem to come down any. This is an extremely expensive service.
To start a new base, just the aircraft cost alone is on the order of around $6 million. There's a lot of emerging technologies that we simply can't tap into because we just don't have the depth in our resources. And these are the reasons why we need the support and the dedication of our sponsors and our philanthropists out there.
There are many small rural communities where they really don't have access to the system. And in recent years, those same communities have lost their hospitals. In order for them to be able to access the healthcare system, organizations like ours need to be able to grow and need to be able to find an economic model where we can reach out and provide services in those communities.
And I think it's important for our constituents or folks that we work with to understand without their support, we can't exist.
CALSTAR is a nonprofit community service, so we rely on donations, corporations getting behind us and supporting us.
Our hope is to be able to continue to grow, to be able to continue to save lives in more and more communities, and to, you know, to the extent we can, improve the quality of life to the people that we serve. To find out more about how you can save lives in your community, contact your local CALSTAR base, call our membership office toll-free, or visit us online.